people still don't quite understand the extent of the work that a midwife does. They often just associate it with catching a baby. But I think because we're not a majority and we're not on people's radar, we continue to have to educate people on what midwives actually do and what their scope of practice is.
I think maybe midwifery sometimes has the reputation of someone who attends a birth and that's it. But midwives care for pregnant people and their families and the babies after they're born for a period of about 6 weeks. They're a primary healthcare provider, meaning that if your pregnancy remains low risk, all of your pregnancy-related healthcare needs are taken care of by your midwife.
There are many benefits to having a midwife. We really invite the families and the women into participating in their own care, so they have some control over what's happening. And the care that's given, particularly in the postpartum period, I find most extraordinary because women don't often have that support. So it's quite comprehensive and a long relationship with these women.
Midwifery supports informed choice, and I think that that's crucial in healthcare. I think people should lead their care and be informed about what the risks and benefits of all available treatments are for them and make the decision for themselves and be autonomous in their care plan.
Doulas are birth support workers. Midwives and obstetrician, gynecologists, and family practice doctors are healthcare providers. And between all of these people, there is a unique set of a skill mix that can offer comprehensive care to women to meet their needs. The Children's Hospital Research Institute of Manitoba is like a research family. They have an outstanding mentorship program. I have several mentors that have supported me in grant writing and helping me navigate the research world. It's really nice to have that supporting body that exists within CHRIM.
Midwifery, if you look at it from a governmental perspective or a cost perspective, has the opportunity to reduce one of the largest costs of healthcare in Canada, which is childbirth.
It's critical to support the growth of midwifery in this province because of the unique skill sets that midwives have to offer. Birth rates are going up and we are seeing a more high-risk population. Sicker babies, sicker moms. In order for our specialists to be able to focus on some of those more complex, high-risk medical conditions in pregnancy, we can alleviate the burden and really focus on the low-risk population. We're all in this to improve maternal and child health in the province. That is our ultimate vision.